Good morning, my name is Sankaria. So today I will be explaining how to give a PEP therapy. So starting off, a PEP therapy is like an alternative for any other type of postural drainage mechanism that you will use, like the percussion technique, the um, vest therapy. This is just like an alternative that you could do. And it is to reverse atelectasis. It also helps you remove secretion from your upper airways. So these are indications for it. And there's different type of PEP devices, which you have the flutter, you have a PEP mask, you have an acapella, the TheraPep valve. It's multiple that you could use. But ultimately, the components consist of the same thing, which is a mouthpiece, the valves, insert just whatever, depending on what you're doing. The first thing you do is going to collect all of your equipment. You make sure you review the physician's orders, go over the patient's chart, um, have the have the device with you as soon as you walk in the room. When you walk in the room, introduce yourself, apply hand sanitizer, or either wash your hands. Um, Make sure you verify the patient. So ask the patient their date of birth, their first and last name. Verify your patient after you've introduced yourself. Make sure that to make sure that you're giving your patient the correct therapy. Um, so then you'll just simply start. First, you're going to check their vital signs. So once you check their vital signs, you're going to check the respiration rate, the heart rate, blood pressure. Um, just just check their vital signs, because if you don't check their vital signs, it's very important to do so, because it tells you how much of therapy they need. Because it's just, you make sure that you're checking their vital signs correctly. And once you check their vital signs, you're going to then begin to instruct them on how to do the actual therapy. So, and this is just one of the many, like it's a mucus clearance adjunct. So this is just one of many, but you're going to assemble the device in front of them, which it consists of a mouthpiece, a resistance device, a one-way valve, a tubing, and then a manometer. So make sure that you're putting everything together correctly. Make sure you're not having any mistakes, or you're going to have to test it out, just to make sure that everything is put in place correctly. Then you're going to start instructing your patient on how to actually use the device, which you're going to tell them to take a deep breath and then exhale forcefully into the resistor. And the IE ratio is 1 to 3 or 1 to 4. Just meaning the inspiration is 1 and the expiration is 3 or 4. So once you do that, you're going to make sure that the resistance setting is at a pressure of 10 to 20 centimeters of H2O. And then you're going to make sure you're instructing your patient to continue to do this with 10 to 20 breaths. Once you've done that, you're going to remove the device and tell them to give you 2 to 3 huff cuffs. And that's just them forcefully making themselves cough. And so it takes a lot of work. It's a lot that comes with coughing. So you will have to allow your patient to rest if they do need it. But once you do that, once you keep repeating the cycle after the huff coughing, don't do it past 20 minutes, but continue to do it until you see a difference, until you see it's actually helping them, but don't exceed 20 minutes. Then you will, a nebulizer MDI is probably indicated with the bronchodilator therapy as well. But with the flutter therapy, you are going to assemble the device once again. Make sure you don't have any errors, any kinks. Just make sure. So you're going to instruct the patient to tilt their head slightly upward so you can keep the airway open, and then they're going to take a deep breath, and they're just going to exhale forcefully into the flutter valve, but without puffing their cheeks. So naturally, but not too hard where they're having to puff their cheeks up. So you're going to make sure that the device is angled, so the adjusted um, flutter sensation you can actually get within the chest. And then you're going to keep repeating this for 5 to 10 breaths, and you're going to do 5 to 10 breaths of this, and you're going to follow that by huff coughing, which is just forcefully making themselves cough. You're going to keep telling the patient and coaching the patient that this is to maximize, like, this is to help them remove mucus secretion all from their system, but don't exceed this. Don't go past 20 minutes of doing this therapy. Allow the patient to get a break. So once you do this, you're going to just make sure that the patient understands how to do exactly what you need them to do with this therapy. You're going to let the patient talk to you and show you that they understand how to do it, and then follow up with doing their vital signs and making sure the levels went down so you can make sure that this therapy is effective for them. And that's it.